Hey everybody. So I recorded this lecture, but it's been processing on my computer for like an hour. So I'm gonna do it again because I don't know why it's not loading and I don't know. I can't click on it. It's weird. Okay, let's just do this again. Great. My lecture is on autoimmune inner ear disease. What is it? Autoimmune inner ear disease occurs when the body's immune system mistakes normal cells in the inner ear for a virus or bacteria and begins to attack them. It creates inflammatory reaction that can lead to problems with hearing and balance. Just a brief overview of some signs and symptoms of this disease. Hearing loss that progresses rapidly in both ears occurring over weeks or months is a pretty strong indicator that a patient might have an autoimmune inner ear disease. The patient might also experience tinnitus, a plugged or fullness feeling in the ear, vertigo, and dizziness. And then statistics. This is pretty rare. It's estimated to account for less than 1% of all hearing loss cases. So excuse me, it's not common at all. The incidence is less than 5 cases per 100,000 a year. The prevalence is about 15 per 100,000 in the US, and it has been shown to be more prevalent in women, and specifically within their third or sixth decades of life, so their 30s or 60s. And then the site of lesion for the autoimmune inner ear disease is the inner ear. And the etiology and pathology. So I kind of explained this in the first slide, but basically we have all these immune cells within our body that are looking to fight off any germs that are trying to invade our bodies. And so with this autoimmune disease, these immune cells are mistaking cells within the inner ear as viruses or bacteria. And this is classified as an autoimmune reaction. And then it's also been shown that 30% of individuals who have this disease also have another autoimmune disease. The most common are rheumatoid arthritis, lupus, scleroderma, ulcerative colitis, and Sjogren's syndrome, which is just a person that has a dry eyes constantly. And then diagnosing it, it's not very clear how to diagnose this disease. Your audiologist will complete a case history and hearing test, and then they might also complete balance tests. They might also do blood work, have your blood tested. And this is often mistaken as just an ear infection because a lot of the symptoms are the same, but besides, well, yeah, so a lot of the symptoms are the same. So a lot of these cases are misdiagnosed as ear infections. And so if your audiologist suspects that the patient has an autoimmune inner ear disease, then they might actually start implementing treatment and the medication before they even have a clear diagnosis. And that's really how they get the diagnosis, is that if after the after beginning the treatment, beginning the steroids, if the symptoms get better, then they can kind of classify it. Okay, yes, we know that it is an autoimmune inner ear disease. And then treatment and management, the most common is that a doctor is going to prescribe steroids, specifically oral corticosteroids, to reduce the inflammation within the ear. And then these treatment options they were more common back in the last few decades. They are now, but I figured I would add them in here because some doctors still do use these treatment options. And they include immunosuppressive agents to suppress the immune cells which block protein triggering inflammation. And then a procedure called plasmapheresis And this procedure is when a doctor goes in and withdraws blood from the inner ear, and they are removing the antibodies out of the blood. And so that they're basically like recirculating the blood, your body with quote unquote clean blood. And then if the patient's hearing loss is significant, then they might opt for cochlear implants. And then I have a video. Where is it?
People think unusual circumstances means complicated taxes. But for a TurboTax Live expert like me, it just makes things.
Autoimmune inner ear disease or autoimmune hearing loss is, at least at this point, I feel like I'm seeing a little more. When you say autoimmune, means that somehow our protective device, your immune system, rather than attacking external or invasive organisms or bacteria, it's actually attacking our own body for some reason it doesn't recognize, and that's why it's called autoimmune process. So one of the places it can attack is your inner ear and leads to hearing loss and leads to some dizziness and so other ear symptoms. To be honest, we don't really know why that occurs, just like a lot of times we don't know why people get other type of autoimmune processes. So presumably there's a mix of some genetic predisposition for some people, and then you get some environmental factors that leads to having that occur. The most common symptoms that makes us suspicious somebody has autoimmune disease is a sudden drop in hearing. So typically, people may wake up one day and just say, oh my God, I can't hear on that side anymore. You can get ringing in the ear, you can get some dizziness associated with it as well. The treatment is steroids. If we can diagnose that and discover the person losing hearing early, we can, with a steroid, seems to get reversed. We can sometimes get the hearing all back. It's important after hearing this, when you hear somebody say, oh, my hearing is gone, don't wait. See somebody quickly and so you can get the, it's possibly this, and so you can get treated and it can be reversed.
So what I thought was really cool with the video is how, like the doctor said, if this is caught early enough and steroids are implemented early enough, then the person might be able to regain some of the hearing that they had lost, which is why it's really important if a patient or an individual is experiencing any sort of hearing loss and any symptoms that can correlate with this disease, that they go to a specialist as soon as possible, because it might be reversible. So they don't always lose all their hearing. With the steroids, they might be able to get that back. And then let me just show you my references. So here are my references. And yeah, that's all I got today. Can I just show you guys though, real fast, so you don't think I'm making this up? Do you see this? It's been converting for literally an hour. I don't understand, but it is what it is. So I'm sorry that this is coming to you late, but I hope you guys have a great week. Bye.